If you're currently suffering from a bulging disc at the L5-S1 level, then today's video is going to give you some of the best exercises for treating it. Hi everybody, my name is Will Harlow and I'm the Over-Fifties and Sciatica Specialist Physio here at HT Physio in Farnham. And today I'm going to be revealing my 5 most commonly prescribed exercises for bulging disc L5-S1 pain. Now, before we dive into the content of the video, if you get to the end of this video and you found the content useful, please consider subscribing to the channel because then you'll be the first to hear about our new content. And if you do enjoy it, please share it with someone else who you think will benefit from it. Now that that's been said, let's talk about bulging discs at L5-S1, what they are, why we need exercises to fix them, and why I'm making a video specific to that level of the spine. So a bulging disc is an injury that occurs to the discs that sit between the vertebrae in the spine. So this is the human spine here. You've got the pelvis, you've got the vertebrae, which are these white bones here. And in between them, you've got these things, which are intervertebral discs. They kind of look like jelly in this diagram model here. But basically what they are tough outer bands of collagen fibers that are wrapped around like this. And then you've got a fluid center in the middle. And the discs are different to the bones in that they're flexible, they're a soft tissue structure, so they move around, and that allows us to bend and to twist and to keep healthy bones because the discs supply them with nutrients. Now, the discs, because they're made up of soft tissue, they can wear away over time, or they are susceptible to developing little weaknesses in their outer layers. And if those weaknesses get to a certain point, then a bulge can form in the disc. And the bulge looks something like this. And the bulge happens when the fluid center of the disc starts to push out towards the back of the disc through one of those weaknesses that we just mentioned. And if that bulge comes out at a certain angle, it can press on a nerve and that can cause pain. Now, with an L5-S1 bulging disc, the common symptoms would be sciatica, which is nerve pain in the leg, and that can go either down the back of the leg or the side of the leg with an L5-S1. It can also cause back pain, it can also cause buttock pain, it can cause pins and needles and numbness in the legs or the feet or the toes. It can also sometimes cause weakness in some of the muscle groups in the legs, namely the toes and in the ankle, most commonly with L5-S1. And it can be quite an unpleasant condition. It's also incredibly common. And we're going to talk about how to treat it today. Now, a bulging disc at L5 or S1 can start either suddenly, and the typical case of this is if someone's bending forward to pick something up from the floor and they feel this sudden onset of back and leg pain. It can also start slowly over time. Sometimes there isn't an obvious incident that caused it. It can just develop very slowly. But whatever's caused your L5-S1 bulging disc, for most people, 95% of people, it can be fixed with conservative measures. So physiotherapy and getting the movements correct, not doing things that aggravate it, and doing everything we can to encourage healing of the disc. Now, the reason I'm making a video specific to the L5-S1 level, which is this one here, right at the base of the spine, is for a couple of reasons. Number one is because it's my most requested video to date. So we're going to satisfy hopefully a few people who watch videos on this channel. Number two is that it's the most common disc injury in the spine. So this is the most commonly injured disc. And the reason is because if you look at the angulation of the spine, this is the natural curve that we have. This disc here sits at what we call one of the apexes of the curve. So it's the most dramatic point of the curve. So it's under quite a lot of stress and strain when we move and we walk around. The other reason it's so common is because it's at a transition point between two types of vertebra. So we've got the L5 vertebra here, and then we've got the sacrum, which is a completely different shaped bone. And this is almost like a design flaw in the human body. We tend to get more injuries at the crossover point between two bones that are shaped in a different way. So we get injuries at L5-S1. We also get injuries at T12 and L1. And we also get injuries at C7 and T1 up in the spine. And this is where the bones are not the same shape, so really they don't fit together quite so well. So that's why we're making a video about this. And the other reason we're making a video specific about exercises for this region is because there are ways to target this exact region with your exercises. Obviously, general back exercises will usually help if you choose the right ones, but there are ways we can be very specific and target the region right at the base of the spine. So that's what I'm going to show you how to do today. The other reason we're making a video specific for L5-S1 bulging discs is because the nerve pain that people get in the leg from this problem tends to follow quite a specific pattern, and we can also target that pain pattern in our treatment as well. Now, if that sounds quite confusing, just watch on because I'm going to explain it all as we go through the exercises. So in the 5 exercises I'm about to show you, we have 3 goals that we're trying to achieve. The first goal is we're trying to improve the range of motion at the spine. After a bulging disc injury, we're going to get very, very stiff in the spine. We're going to be limited. Most people find that they have some back pain as well, so they struggle to bend or they struggle to rotate. And we want to restore that movement of the spine because that promotes healthy, normal movement. It also reduces sensitization so that the body sort of learns that it's okay to move again. And it also improves blood flow to the injured area. And that brings us on to the second thing we're trying to achieve, which is to bring nice, healthy blood flow to the injured disc, which should promote healing and get that disc to hopefully knit back together so that the bulge re-centralizes and goes away. And then the third thing we're trying to do is obviously reduce pain and stop that sciatica by improving the health of the nerve, improving the flexibility in the leg, and trying to minimize inflammation around the nerve. So those are the 3 goals, and I've got 5 commonly prescribed exercises that do just those 3 things. Now, before I show you what they are, it's really important for me to mention that these exercises are not going to be suitable for everyone with a bulging disc L5-S1. A big part of what I do here is assess people and give them the specific exercises that work well for them. And because you're just watching this video on YouTube, I haven't had a chance to assess you, so not all of these exercises will be suitable for you. So it's very important that you go and speak to a healthcare professional with these exercises and ask them whether or not they're sensible for you to do, because not all of them will be. And the list of caveats is too long for me to describe on this video, or we'd be here all day. Now, the next important thing for me to say is that these 5 exercises are not the only 5 exercises that work for bulging discs. There are lots of other exercises out there that will help the problem, and these are not the only ones that work. You might find a physiotherapist who treats you and they give you a completely different set of exercises, but those ones work better for you. So do not use these in place of what you've already been given. And the other thing to say is that these exercises are not the best way to treat bulging discs. I'm not claiming to have the magic fix for it. They're just the ones that I find myself most commonly prescribing to my bulging disc patients. And I hope the information that I provide today will be useful for you. So all of that being said, let's have a look at these 5 exercises. I'm going to show you them one by one, and I'm going to explain how each one works as we go. So the first exercise I often give to my clients who have an L5-S1 bulging disc is called the Cobra. And this exercise serves 2 purposes. The first purpose is to improve the blood flow to the injured disc within the spine. My theory as to why bulging discs take so long to get better is because they don't have a very good blood supply. So if we can do everything we can to improve blood flow to that area, and the best way to do that is movement, then we can usually speed up the healing of the disc. Now, the second thing the Cobra does is it restores normal spinal mobility. Okay, so the Cobra often works because when people have bulging discs, for around 80% of people, bending forward makes the problem feel worse, and standing up straight or leaning back makes it feel either better or just about the same. So this exercise involves that movement of leaning back. So how this works on a skeleton is the Cobra involves this kind of a movement with you lying on your front. So we're going to have a look at that in a moment, and what it's designed to do is to improve blood flow to this area here, the L5-S1 disc. So let's have a look at the Cobra. So if it's appropriate for you to try at home, you can do so. So for the Cobra to work, you need to start off on a flat surface, either the floor or a very firm mattress to make this work. Ideally, you want a yoga mat on the floor just to make it more comfortable for you. And this exercise should only be done if this movement makes the pain feel better or doesn't change it. If it makes it feel worse, you should avoid this exercise because it's not perfect for everyone. Now basically, you start off lying on your front with your hands underneath your shoulders like this, and you have your head close to the ground. And then all you do to make this exercise work is use your hands, use the strength in your arms to push the upper half of your body up like this. Now, if you can see my pelvis, it's staying down on the bed. So the pelvis is not lifting, okay? And you'll also notice that when I do this exercise, I like to do it whilst keeping the movement going. I don't tend to hold it. If you were to do this exercise in yoga, you'd find people hold it there for 20 or 30 seconds. But when I'm doing it for a bulging disc, I usually tell my clients to keep the motion going throughout, because in my mind, that's the way we improve blood flow to the injured area. And it also seems to be more effective at reducing pain. Now, you can vary where your hands are to give yourself more or less control over the movement. But the key here is you don't want to be taking it right up into pain. So if this hurts, just don't go this far. I've had people come in and they're just doing the movement to here and then back down. And that has been effective because even though we're not going all the way to the top, we're still getting that blood flow to the injured disc. We're still getting movement. And even that small movement can still give results. So don't worry about how high you go. You don't need to be able to lock out your elbows. And for most people, that would be too far anyway. So you're just going to do this exercise within a comfortable range of motion. For most people, I recommend doing 10 in a row, at least 3 times a day to make this effective. Now, the second exercise that I often give to my clients with an L5-S1 bulging disc, I like to call the seated forward tilt. This is a great exercise for people who can sit comfortably with a bulging disc, but when they start to move around and they become active, the pain gets worse. And this exercise works by improving the movement of the pelvis and the spine. We find that people with bulging discs that are painful tend to have very stiff spines, so they can't bend forward or they can't twist easily because everything moves together, so they end up moving around like a robot, and that's not ideal for getting blood flow to the injured area. So what we need to do is we need to loosen up the spine. So this exercise involves what we call pelvic tilting, and pelvic tilting just means having your pelvis like this and either tilting it forward or back. So to make this exercise work, you're going to start seated. Ideally, you're going to have your feet on the floor, although mine are off the floor just to demonstrate. And what you're going to do is you're going to put your hands on about your belt line. Now, if you're relaxed and you have a wiggle around and you just let your spine sink into its natural position, you're probably near enough to what we call neutral. So that's where the pelvis is in a neutral position. So what we're going to try and do is we're going to try and give us an anterior pelvic tilt. And the way we do this is by rolling your sitting bones forward. Okay, so we're basically imagining we've got a tail and we're trying to stick that tail up in the air behind us. So hands on the belt line, and we're going to roll the pelvis forward, and you should feel your fingers drop down but your thumbs lift up, okay, if you're doing this correctly. And if you look at my upper body, it's staying stable, so I'm not bending forward, I'm not doing that, or I'm not doing that. I'm keeping my chest and my shoulders in the same position. It's just my pelvis moving. And what we're doing is we're going to a forward tilt and then just back to neutral. I don't usually ask my patients to go into posterior tilt because that can put more pressure on the discs in my mind, which can sometimes aggravate the injury. So we're just alternating from neutral to forward tilt and then back to neutral and forward tilt. And this is a nice exercise just to encourage that movement of the spine whenever you're sat down. So this is perfect for office workers. Again, we don't need to hold the position. We just need to tilt forward and back. I'm probably going to do this about 10 or 15 times in a row to make it effective. But you can do this every few hours whenever you're sat down, and it's a good way to get blood flow back into the spine to get that movement better if you can't get up and do exercises on the floor. So I would give that a try, especially if you're an office worker or people who sit for a long time. Another great exercise for a bulging disc at L5 and S1 is something I call wall side glides. And these are great exercises for improving the mobility of your lower spine and reducing the sensitivity of the pain in the leg. Can also help with the back pain as well. So wall side glides make up part of something called the Mackenzie method, which is a strategy for treating sciatica, which was designed by someone called Robin Mackenzie. And basically what it's designed to do is to improve the blood flow to the disc, and it also helps you to move in a way that feels usually pain-free for the person involved. So what we're going to do is we're going to pretend that I've got the sciatica from a bulging disc running down my left leg. So if it's my left leg that's the problem, to do this exercise, what I'm going to do is I'm going to stand with my right side next to a wall. And I'm going to prop my right arm up onto the wall like this with my forearm supporting my body weight. And I'm going to lean so that I'm in this kind of diagonal leaning shape against the wall like this. And my left hand is going to go on my left hip. So now the exercise is incredibly simple. All we're going to do is we're going to try and glide your right hip, so the one that's not painful, towards the wall. And then just come back to the center. So this should be completely painless. And I'm moving towards the non-painful side. So remember, this is my painful leg. And I don't need to touch the wall. I'm just moving towards it. And that just helps to get some spinal movement back. So get some range of motion back into the spine. And it also encourages healing of that disc. Now, if you had pain in your right leg, what you would do is you would turn with the left side next to the wall, your hand on your right hip, and you glide your left leg towards the wall like this. Now, what I found with my patients is it's very, very important that we only do the one side, okay? So if it's your left leg that's painful, you do the right side only, and if it's your right leg that's painful, you do the left side only. If you do the opposite side, it can often make the symptoms feel worse. So that's just a tip from me. Just do the one side. And we do this exercise very similar to how we did the Cobra, in that we keep it moving and we do 10 in a row, and we try and do that a few times a day. It brings nice healthy blood flow to the disc, helps to promote healing, and should decrease the pain as a result. Now, one of the other 5 most common exercises that I give to people with a bulging disc L5, S1 is something I call nerve flossing. And this exercise is not designed for spinal mobility, but it's designed to restore the health of the sciatic nerve. So when you have a disc bulge at L5 or S1, the pain pattern in the leg that people usually get is either pain running down the side of the leg into the calf and the outside of the foot, or straight down the back of the leg into the toes, going down underneath the heel. So if it's going down the side of the leg, we tend to think of that as more of an L5 pattern. And if it's going down the back of the leg, we tend to think of that as more of an S1 pattern. And those are just corresponding to the nerves in the spine. So if your L5 nerve is more irritated, it tends to be down the side. If your S1 is more irritated, it tends to be down the back. Now, this exercise is a really nice one for many people for loosening up the nerve. The way that it works is it's supposed to improve the mobility of the nerve as it runs through those tight spaces in the back and the leg. And it tends to bring down the sensitivity of the leg and reduce sciatic leg pain as a result. So I've got a video that describes this exercise in more detail, but I'm going to show you how to do it now. So basically, we're working off the premise that the entire nervous system is connected, and we can put tension on one end whilst taking tension off on the other end of the body. So let's have a look at the movement. I'm going to pretend it's my left leg that's the problem here. So the first thing I'm going to do is I'm going to assume a posture where I put one hand in front of my tummy and one hand behind my back. And I'm just going to support myself as I slump forward. And I want my head and my shoulders down and my knees bent. So this is your starting position. And then your second position is as you lift your head and your shoulders, you're also going to lift the painful leg. And we want to come right up with our neck and our shoulders. Now, if you're doing this correctly, you might feel a little bit of tension in the nerve in the leg. If you get too much tension or it becomes very painful, then don't lift the leg up as high, just lift it up a little bit, okay? And then what we're going to do is just drop back down to the start. So it's a very simple movement. So we're just alternating between leg up and head up, and then leg down and head down at the same time. And we're not holding it, we're just moving it between these two postures. So leg up, head up, leg down, head down. And if we're doing this correctly, we shouldn't actually feel very much pain or very much tension at all, because as we put the tension on here, we're taking it off here. And vice versa, as we put the tension on here, we're taking it off here. So really what we should do is end up with a nervous system that slides up and down, including the sciatic nerve. That's the theory behind how this works, and it can reduce the pain in the leg. We usually recommend that people do about 30 seconds of alternating between those two positions. Again, 3 times a day would be ideal for most people. For some people, this exercise makes it feel worse, and if that's you, you should definitely avoid it. So only do this exercise if it makes it feel better, and that's the case with all of these. So the next exercise that I often give people with a bulging disc at L5 or S1 is another one that's very, very useful for reducing nerve pain in the leg. And it's one that I've found very effective for people who have more of an L5 pain pattern, which is pain going down the outside of the leg, sometimes all the way down into the foot. Now, this exercise, again, is a bit of an unusual one. It's one I discovered a while ago that can really help with this sciatica type of calf pain that people get. It does also help S1 sometimes, but it's a useful one nonetheless for just about anyone with that sort of L5, S1 bulging disc pain pattern. So basically what we're trying to do, again, is we're trying to mobilize something in the leg that's going to help the whole nervous system to free up a little bit. And basically this works because one branch of the L5 branch of the nerves that go into the leg wraps around what we call the fibula head, which is right up near the knee, okay? And basically when the nerve wraps around that bone, my theory is that it can get irritated or it can get very sensitive for people who have a problem at the L5 region, and that can make the pain in the leg worse. So if we loosen up that area, it seems to reduce the sensitivity. So I'm going to show you how to do it. I've shown a video in the past of me doing it in a sitting position, but I'm going to show you how you would do it if you are not comfortable sitting, which is the case for many people with a bulging disc lower down in the spine. So what you would do is you would find a platform, something like a chair that is, normal chair height. This is a bit higher than what I would tend to use, but I'm just having it high just for the purposes of the video. And you would try and put your affected leg up onto it. Remember, it doesn't need to be this high, it can be a bit lower down, but hopefully you can see my leg quite clearly. So for an L5 pain pattern, it's usually going down the outside of the leg like this. So what I would first do is try and find the fibula head on the outside of the leg. And you can find the fibula head by finding your knee, and then you just come to the margins between the knee bones, and then you come a couple of inches down, and on the outside of the top, the uppermost part of your calf, you should find that there's a knobbly bit there. There's a bone on the outside. It's underneath some muscle there. And that is the head of the fibula. So that's what we're going to be looking at today. So you're going to keep your knee in about this 90-degree position with the foot rested quite comfortably. And you're going to take the heel part of your hand on the same side, and you're just going to tuck it behind that bone on the outside of the leg. And now once you've found that part on the outside of the leg, you're just going to push firmly forward as if you're trying to push that bone out the front of your leg. And it's not too rough, but it's quite a firm push. And as you do so, in this position, what you can do is you can gently rock forwards as well. Now, what you'll find is you might find this weird kind of movement thing happening at the top of your leg as you do it. You might feel like something's sort of loosening in your leg as you do it. It might just feel like an odd thing, or you might feel nothing happening at all. What we shouldn't find is that the pain gets worse. If it does, we should stop. But what many people find when they do this for about 30 seconds is directly afterwards, the nerve pain in their leg has reduced. And that is a great sign. That means that you're probably loosening up the right things. And if it helps the one time, then it's likely that if you keep coming back to it, it will continue to help. So you can see this is quite a gentle sort of rhythmical movement. As I push forward with my hand, my knee is gliding forward. I'm just changing that knee angle. Now your leg, remember, doesn't need to be this high. It can be a bit lower. And what I'd recommend most people do is they do about 30 seconds of these, sort of gliding in and out, 2 seconds forward, 2 seconds back. So 30 seconds, and you can do this every few hours if you find that it reduces the pain in your leg. What many people find is that the pain from here downwards is lower after they've done it for a little while. If it doesn't work, then it's not worth continuing, but if it does work, it's something you can keep coming back to. So those are my 5 favorite bulging disc L5-S1 exercises. I hope if you give them a try that it helps, but make sure you get checked out by your healthcare professional before you do so. Anyway, that's all I've got for you today. If you found this video useful, please leave a comment below, subscribe to the channel and share it with a friend or a family member, because then you'll help that person too. And if you want to get more from me, I have a book available on Amazon that has loads of stuff in it about back pain and sciatica. It also has loads of general health information too. It's called Thriving Beyond 50, and you can find it on Amazon using the link below this video. Anyway, thank you very much for watching. I appreciate your time, and I look forward to speaking to you on the next video.